Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Late September, early October. But now's the time for doctors to order the vaccinations if you haven't, so that when September and October rolls around, if you haven't. We know that the only question is how often will we need to have the RSV? We know we'll need the COVID at least once a year. And it's suggested that we may need RSV once a year, but I'm positive about that. But it's clear that we need to have the immunizations ready to go by late September, early October, and it's already the 22nd of August. So we're about ready to begin the flu season. So it's an important question to be ready to, and for our doctors to, and pharmacies to get vaccinations ready. Okay, I think that's the essence of that article. This is an article that talks about the top COVID symptoms people are experiencing, and many of them are very similar. The one thing that become more common, of course, is a sore throat and a runny nose. We have symptoms that are not near the same symptoms that COVID has. There is some articles that are suggesting that people with autoimmune diseases should be wary of COVID and should doesn't get treated in it's not very mild in the first few days. That maybe that treatment might be.
Excuse me, Dr. Callender. Can you move a little closer to your microphone because you're breaking up a little bit?
Oh, okay. All right.
Okay, that's a little better. Yes, sir. Thank you.
Yeah. Okay. All right. So that long COVID apparently is more common in people that have autoimmune disease. But have COVID, and it's not extremely mild that you may want a medication or something. The question is, with the new variant, do you need to get a second vaccination? So far, it seems as though the vaccine is adequate. The summer surge seems to die down to some extent, although our church is still recommending to wear masks. And these are the laundry list of all of the kinds of symptoms of the COVID as we. The only one that is kind of new is the diarrhea, but that's more common than they used to be. But the others pretty much have always been there. One of the things that has been interesting is that there hasn't been a demand for the vaccine to be given every 6 months. So it looks like it's going to be a yearly vaccine. For RSV, it still seems to be it's going to be ethical, but we haven't gotten any recommendation to change it. So it probably will be annual, main annual. Now, of course, the recommendation is that you continue to wash your hands and wear a mask as appropriate. Protect yourself. getting infected. Any other comments or questions about preparing for the flu season to come upon us? Good.
Good morning, everyone. Dr. Calendar, did I hear you say that the RSV is a yearly?
That's the initial recommendation, and the CDC has not changed it yet.
Okay.
So if they're going to change it, they would come out with some information by September. But it's annual. So there was some discussions about whether you would need it annually, but so far, the recommendation is still for annual. Now, this is another article that talks about the fact that one, the autoimmune diseases are really more common than ever before, and patients with autoimmune disease seem to have a higher incidence of long COVID. And when you say autoimmune diseases, what are we talking about? Talk about diseases like type 1 diabetes, lupus erythematosus, autoimmune thyroiditis, and there are a number of multiple sclerosis. These are some of the autoimmune diseases, and there's a lot of evidence that these are increasing more now than ever before. We're not sure why, but that people who are immunosuppressed or have autoimmune disease more likely to have. Okay, let's go to the next one if there are no comments. And this is an article that indicates that we're having more prevention, but deaths have tripled in the last 20 years. And the thinking is that this is because we're having dementia earlier and more people. We know the longer you have the dementia, the more likely you are to have swallowing muscles, aspiration. And women in black adults are more common with others to have dementia. One of the things that I think John Tatum alluded to is that 50% of dementias can be prevented, I believe. We don't really have a good treatment for dementia, but we do have ideas on the 14 disease entities that predispose. See some more. And here's a laundry list of those right here. You can see that there's education, head injury, physical activity, smoking, excessive alcohol consumption, high blood pressure, obesity, high cholesterol, hearing loss, depression, and social isolation, so on. And so those are the things that we need to avoid in our effort to prevent this. Early diagnosis is something that they talk about. And I think the importance of early diagnosis is so that your family and other caregivers can be more helpful to you so that you can prevent them from doing things that will hurt themselves. Not so much that we have a treatment that is effective, but we can help them do things and do more things to help them, to protect them from themselves. And have family members around them to keep them from being lost, keep them from being of unsafe practices also support the person. Any comments about that? Because all of us have experienced some of them.
I'm not able to see the articles. Can anybody else see the articles? Oh, you can see the articles. Okay, it's just me.
Yes.
Just you,
Yeah.
huh? Wonder why.
Dr. Calendar, your audio is breaking up. I don't know if that's just me, but it's not real clear like it usually is.
John Buchanan, I think that's just you. Darryl
You-
can't see and you can't hear.
But your audio is crystal clear, and Daryl's is
not-
clear.
It's
Just
not
not
just
John.
John, it is breaking up.
I'm with
Okay.
John Buchanan. It is breaking up a little.
Okay.
Let's go to the next slide then. And this is a detailed article in terms of how it is highly preventable. When they say highly, they talk about 50%, which is better than zero. And in many ways, I think it's important to look at the risk factors which you've identified. Darryl, can you see this one? I guess you can see. But this details, as the other one did, the modifiable risk factors, many 14 factors that seem to be associated with Alzheimer's. And we are now suggesting that if we do things to decrease those, that we're likely to decrease the incidence of Alzheimer's. Any comments about any of those modifiable factors that associated with prevention of Alzheimer's?
Are the 14 factors listed in the article? I'm looking.
Yes.
Where?
Yeah,
Oh, right.
right.
Okay, okay.
Dr.
Oh.
Calendar, of the other countries, how do we rank compared to the other countries with having dementia and the ranking of dementia among citizens?
I don't know.
Okay.
It seems as though it's a global phenomenon, but I don't know a rating of the United States versus other countries as it relates to prevention. But most of this data is about dementia in the United States. There's an article that says that one of the modifiable factors is high blood pressure, and if you don't treat it, then your likelihood of Alzheimer's is 42% higher, almost double. And the same thing may be said for the other factors, particularly as I think Darryl has mentioned the hearing issue, as well as all the other factors, the other modifiable factors.
Back to Sylvia's question, and I can see the screen now. Country rankings for dementia. Finland is number one with a rate of 54. United Kingdom 42. United States is at 33. We're number 8th in countries. Some states with low ratings of dementia, like Jamaica 15, Italy 14, India 14. Japan 7.8. So that's something that I didn't expect. It looks like a lot of what they call developed first world countries have higher rates of dementia.
So it would be more important for us to really address the modifiable causes of dementia. And there is some data that suggests that the processed foods contributes. There's an article you'll see later on. I think this paragraph takeaways says it all. Well, it reduces the risk of high blood pressure, also reduces the risk of dementia. They are related. Okay, this is you know, as you look at things, it seems like everything's related to cognitive impairment in later life, and they're trying to relate severe menopause symptoms as well. This association opens up time or just the only issue when you have retrospective studies like this is that it's hard to really know the cause and effect. So the data is impressive. Still retrospective. And it's not like you can do anything about whether or not you have severe menopausal symptoms. I mean, menopausal symptoms are not. If you have it, you have it. What you can do. Now, this is something that is not very attractive. The risk of cancer is high if you drink alcohol, even moderately. You know, we have a lot of studies that say one drink is good for stomach sake. There are those who feel it. The best alcohol is no alcohol. And we should be saying that. There's another article telling me included. She talks about myths about alcohol. And, but it is clear that moderate drinking does increase risk of cancer and other disease. Any comments about this? You know, it's fashionable and social to drink, but it's also risky. Any comments about alcohol and its impact on increased death rates? Alcohol.
Maybe the fact that I don't take any medicine is because I don't drink alcohol.
I think it's got more to do than just that.
Maybe that's a start.
But it didn't hurt.
Doesn't hurt. Doesn't hurt.
Didn't hurt. But there's many more factors that have to do with your good health.
My comment is that women have less alcohol tolerance than men, so it's more dangerous for women.
Yeah. Should you stop drinking alcohol? Yes.
So should we start drinking more wine?
That's alcohol.
Okay.
Yeah, the equivalents are 12 ounces of beer, 5 ounces of wine, 1.5 ounces of hard liquor. That's all considered a drink, and the body doesn't care what if it comes in the way of wine, beer, or hard liquor.
Well stated.
Doggone.
And this is another article that points out that is after 60 linked to early death, and there's so many ways in which alcohol is linked to cancer, one of the cardiovascular disease. And other. So the moral is that, as Darryl said, many consider alcohol poison. Okay, this is a great article that it talks about the 5 common alcohol myths, and you can go down them one by one. And of course, they talk about this one best. Red wine is good for your heart. One drink is good for your stomach's sake, all that. Most of the research does not support that red wine is good for your heart. Grapes may be good, not red wine. This article doesn't agree with that. Then the second myth is a nightcap before it will help you go to sleep. And as they look at that from a scientific perspective, it doesn't seem to add up. I don't know those people who drink. Have you never said it helps you sleep? None of the data support that is drink. And then this myth introducing kids to wine, help them have a healthy relationship with alcohol when they're older. That's it. That's interesting. I never heard that from any black families. But, any of you familiar with that myth?
Yeah, I'm very familiar
haven't.
with it.
You familiar with it now?
Yeah, and what usually happens is that parents start introducing it to their children when they're preteens, when they're 5, 6, 7, 8 years old, taking a sip of wine, having some beer, and the kids get a little tipsy and they think it's funny.
Oh, that's unfortunate. Yeah. Yeah. Having a drink in the morning will cure your hangover. That's something that I mean, many are recommending a glass of water. Nobody agrees that this will work. But I tell you what it will do if you're an alcoholic. It'll keep you from going into DTs. But delirium tremens is not as good to have. It only occurs in alcohol. Having a drink will warm you up on a cold day. You go to all of these football games and you see all these people with alcohol to keep warm, they say. And the blood vessels in the skin do dilate, but doesn't warm you up. Any of you tried this? You go to the football games out in the cold, drink alcohol. That's what all of the football fans do. Well, anyway, I guess we're not a drinking group. Well, anyway, those are the 5 myths that people do. Now, this is an article that talks about the BMI which we use to diagnose obesity. And one of the arguments is that BMI alone is not the only way you can diagnose obesity, and also the risk of truncal obesity and butt obesity. It's found that having a big butt healthy, yeah. Having a big butt is healthy, but having a big belly is not. And they think that the big belly indicates that you have a lot of fat around your organs, and this then is what is unhealthy. Whereas a big butt does not carry the same connotation. And so, as a consequence, they're saying BMI is one way of doing it, but waist to hip ratio is another. They're suggesting that waist to hip may be even better. And they're suggesting using X-ray absorptiometry, which we don't do. It's also another way of doing it. But the waist to hip is the other way that you can do it if you don't want to use BMI alone.
Yeah, I just did a Google search on what foods cause the most belly fat, and it says high sugar and processed foods are the common causes of weight gain in the abdomen.
Thank you. Any other comments about this article?
Yes, how do you measure the waist to, what did you say?
Waist to hip. In other words, you get a measure. There's something like a rule, except it's cloth, and you measure your waist in centimeters, and you measure your hip in centimeters. That's the waist to hip ratio. It should be 0.5 or less, or 0.6 or less.
Okay.
So
That
when
is something that more doctors are doing now, but BMI is still the gold standard.
Dr. Calder, and good morning, everyone. Do you know anything more about this semaglutide that they mentioned here?
Oh, yeah, well, that's very common. Yeah, this is well known. Yeah, we talk about it a lot. This is the treatment for obesity. Those are those are the commonest drugs today that are used for the management of obesity. So much so that it's also used for diabetes. They use it so much for obesity that people who have diabetes have difficulty getting it. But that now has really taken over the market of obesity when you don't have surgery. Is Wegovy and the drugs like that. Yeah.
My comment is that the old term about beer belly is absolutely correct, because beer is high sugar, and other things that you could also call it ice cream, potato chips, hot dog, lunch meat belly, because those foods all go right to the belly.
What about cheese?
Actually,
Cheese not
cheese
in that
goes more.
category. Cheese
I'm
is not
sorry,
in that
what'd you say?
category.
Yeah. People that have high dairy consumption, that fat usually goes to your legs. Legs and butt for cheese.
This is an interesting article on the importance of being hydrated, because This article suggests that most people are dehydrated. And it says 75% of Americans are chronically dehydrated. And the 8-cup rule is something that they think you ought to drink at least 60 ounces of water a day. But how many of us do that? That's a good question. But and they have graphics here that show how you have a lot of symptoms if you don't drink much water, and feeling weak, and even have muscle cramps and headache and all that stuff. And that the more you drink, the less symptoms you have until you get to the point where you're adequately hydrated and you have no symptoms at all. At least this goes through 1 week, 2 weeks, 3 weeks, and then a month. And it's a good idea to drink as much water as you can, because being properly hydrated is good for you. And the
One of
idea,
the
go ahead, yeah.
one of the number one ways to get water into your cells faster is with eating fruit. And watermelon is number one on the list. It's a great source of hydration.
Can I
Ms.
say
Geller?
something about the watermelon, Darryl? I've been seeing, I bought 3 watermelons and something was going on. They were mushy inside. They weren't ripe. And then I, look at the YouTube University, and people have been posting the exact same thing that I've been seeing, even organic watermelons, where they're saying that something is going on where they're not ripening or foaming. Has anybody heard that? I mean, because people
You
during the
know,
summertime, you want to drink water. I mean, you want to eat watermelon.
I've been
But
eating it. I've been eating it. I haven't had that problem yet. But,
well,
I've taken
yeah,
back
this
3 watermelons.
really?
One was totally, when you cut it, was mushy on the inside. The other ones were just white, not really ripe. Even though they tell you look for the belly, the yellow in the belly, and all that, they were just. I had to take them back. And there, I have to admit, I think these were the hybrid.
this has
They
definitely
were
been a
what?
season for
One
bad
one
watermelons.
said it was organic though. One of the YouTubers said that they had a problem and it was organic. So I didn't know if anybody else had experienced that.
Well, yeah, this is a season for bad organic seedless watermelons. You get them with seeds, they're going to be good. Seedless watermelons are hybrids, and you know how I feel about hybrids.
Yes.
And speaking of seeds in the watermelon, those little white seeds, are they good for you to eat? My husband and I go through that. He'll eat them, I won't. So I want to know.
I don't think it makes a difference.
Mm.
Unless you have a gastrointestinal problem, could be different, because we have found some diverticulitis in which seeds have been found in the diverticulae, but that's unusual. So the seeds in watermelon, for the most part, are not a problem. But any other thoughts on that matter?
Yeah, of course, the white seeds, that's with seedless watermelon. You get watermelons with seeds, it's going to have the black seeds.
Well, the watermelons, some of them are black, but the little teeny ones are white. So I definitely don't eat the black ones, but I don't like the white ones either. But he will eat the white ones, but I won't. I just
Yeah,
want
yeah, I eat them all, but with the watermelon. So.
okay.
And this is an interesting test that we mentioned before, but this is the first blood test, colorectal cancer, and been FDA approved just last month. And so whether it's available to be used is, it should be, but the value of this is that if it's negative, you may not need a colonoscopy. On the other hand, if it's positive, you must have a colonoscopy. But this does not mean that colonoscopy is not a great test. It's just that this is a test, not, you see, the colonoscopy is done not necessarily to find out whether you have cancer or not. The real value of colonoscopy is to find out if you have a polyp that will lead to cancer. And so you get the polyp removed before you get the cancer. So colonoscopy is not the treatment for cancer. The treatment for cancer is a removal of the colonic cancer. But the colonoscopy results in preventing the cancer because the polyp that is cancerogenic is removed, and therefore you don't get colon cancer. So, but this test, if it's positive, it means you must have a colonoscopy to find out where the cancer is so it can be removed. But it is now available, which was not available before July.
Dr. Calendar, I have a question regarding, the testing for polyps when they tell you to take a sample of your stool and, mail it in and they'll give you the results. How does that, the testing of the stool, is there something the polyp emits that
Blood.
comes through the stool?
If there's bleeding.
If there's
And
bleeding.
also, they also have some tests to look to see if you have cancer cells that are present. But for the most part, the stool test is a test to see if you have any bleeding, which is common with colon cancer. And it's not uncommon with polyps.
Okay.
Okay, let's go to the next one. This is a subject that many older people have to deal with, and people who don't have the proper diet, really. That's the truth of the matter. And it's something that is one of the most difficult problems to deal with, fecal impaction. And what you're talking about is where you can't move your bowels because the stool you have is so hard that it won't come out. And that means that it won't come out. You will be uncomfortable until it comes out, to be frank with you. And then sometimes it gets so bad that all you have is watery diarrhea, which is really one of the end products of that. The best treatment of it is prevention, to be honest with you. It's to have a proper diet, and there are certain, if you have high fiber foods, you don't drink plenty of water, you don't exercise, those things contribute. But I think very few things contribute more to avoiding this than high fiber diets, fruits, vegetables, and whole grains, and drinking water. Some people find that cheese is a good way to get constipated. When you're older and you don't exercise and you have all of that, then you can find that you have stools that are hard. And that's one of the signs that you need to do something about it before it gets too late. When we talk about the treatment of fecal impaction, actually, I talk about laxatives and enemas that can soften or loosen the stool. And then if that doesn't work, then of course manual removal. And manual removal, I've had the opportunity to do that on many occasions, and it's almost like delivering a baby. It's a little uncomfortable, but it's something that if you're impacted, it makes you feel much better. And there are a number of ways of doing it, by surgery or by endoscopy, or just by taking your fingers in. The doctor puts the finger in, gloved finger in, and breaks up the stool so you can have a bowel movement. That gives you an enema. But I think the most important thing to do is to have a high fiber diet and drink plenty of water and exercise so you don't have it. Any comments, any people who've had infections? But it's something that is more common in older people who don't have a high fiber diet and are not exercising. And these are some of the real dire consequences of untreated fecal infection: perforation, peritonitis, infection, sepsis. So that avoiding it is the best treatment. It's not something that people talk about, but it's something that is important to avoid.
Should the average person have a bowel movement daily?
At least once a day, preferably twice a day.
Mm.
Any other comments about this? If not, we'll go on, but this is something that can be a serious problem.
Mhm.
Well, I
You
always
can't
like to
have-
advocate for a vegan lifestyle, which being a vegan makes the go easy. So if you want to achieve your twice a day, just be a vegan.
So does prune juice.
Well, there's a number of ways you can do that. You're right. That's one of the ways.
Two ways.
Okay, but high fiber diet really it's what doesn't. Yeah. Now this is an article that's very unfriendly in the sense that the FDA has recalled many devices, but they still use them. And so the article is suggesting, well, why you recall them if you're still using them? That doesn't make sense, does it? And it's and this article talks about one of the microclinic device, and it spends the whole article talking about how the company has made it safe to use and to continue to use it, even though FDA has said it should be recalled, which doesn't make a whole lot of sense to me, but that's the state of the art, though, that the FDA has said they recall them, but yet they are not recalled. So it's just interesting reading that that is a contradiction in term, that you have a recall and these devices that they say are recalled are still used. And the article kind of refutes the reason for the recall, saying that it wasn't the instrument, it was the lack of the physicians being taught how to use them properly. That's what the article says. But if you have a FDA recall and it's not being recalled, it's a contradiction in term. But anyway, this is just an article to be aware of. But it may not have applicability to the patients because it's something that physicians use. Okay, we go to the next one. This is an interesting article that points out that actually female surgeons' hands are often smaller than men's, and as a consequence, they need different gloves and different instruments. And as we have more female surgeons, the need for more smaller surgical instruments and gloves. And this is what diversity brings to the field of surgery. And as we have more females and everything, that is going to be something that becomes standard rather than an unusual thing.
Making things better.
Okay. Yeah, okay. We'll see if making women presidents makes things better. Maybe. But this is so important. This is what diversity is all about, really. So that regardless of your gender or your ethnicity, things should be equitable. That's what the goal. Gender equity, which has not yet been realized.
But can I just interject? It really doesn't have anything. It's a little aside, but a surgeon that a hand surgeon that you trained recently had to cancel surgeries because of the lack of the specific instruments that she wanted to use. And she was faced with trying, at the time of surgery, changing her plan because the surgical center did not have the specific instruments that she needed. And so when you bring up the point of equity, we, looking from a more aerial view, have to make sure that all instruments, gloves, everything that's needed in the surgical procedure is available, because that can then be a way for discrimination.
Well, I think this is what diversity is all about, to try to establish equity. And, equity is not with us yet, and that's something that we have to work towards, as you pointed out. Any other comment about this? This is another article that talks about the effort to promote gender equity in the field, which talk about in the field of medicine. And they are emphasizing that it does not yet exist. May say things are better, but gender equity is not even close to being present. And we won't even talk about the genders equity in salaries, but having diversity that allows for gender equity is something that is important, and that's why they're having this summit conference, to try to get to the point where you really have gender equity. Surgery is probably the field that is the latest to become concerned about gender equity, but it is something that is not present in any field, OBGYN or any other field, but something we have to work towards. And them having a summit like this is an important step. One may argue that that is true for every profession, and I wouldn't argue. Any other comments on this and the role of women in all fields?
You know, someone has to say it, but maybe when Kamala gets in the White House and they see that a woman can run the country, things may change a little.
Hallelujah.
Well, first she has to get in the White House.
I say it once she gets there. Yeah, that's true.
I think it'll change a lot.
We're putting her there. Not if, when she And black
Okay.
women are gonna do, we're gonna do it. The entire country's gonna do it.
Yeah.
Well,
we
the women-
won't go back. We won't go back. We
women-
won't go back.
The women can do it, but
Yes.
will they? I mean, they didn't put Hillary in. They're the reason Hillary wasn't in. So the question is, will the women together work together for a common cause? That's the question. Will they? They can do it if they want to, but will they?
Aren't there more women than men in the United
Yeah.
States?
Yeah,
Mhm.
Okay,
they can do it if they want to.
Yeah.
that should answer that question right off.
Yeah.
We want to and we will.
Look
Okay,
at
we
the
shall see.
odds. Look at the odds. We're getting more and more people, so chances are looking pretty good.
Really
We
good.
shall see. We shall
Yeah.
see.
Yeah.
The proof of the pudding is in the eating.
But Hillary did win the popular vote. So
Yes,
won the electoral college.
that's right.
She won the popular vote. So
Mhm.
Who's that?
Hillary
Hillary.
Clinton.
Oh,
So
oh,
we did
but
do
it
it.
doesn't really matter.
Yeah,
Electoral.
but I mean, women were out there voting, but
No,
I guess
no,
they
no,
just
no.
weren't in the right
And
places.
the electoral
They voted.
college was
The
before
white
women.
women voted against Hillary. That's why she lost.
Yeah,
That's true. That's true.
that's true. But of the people that did vote, she won the most votes. That's all I'm saying.
Well, that doesn't carry very much weight because the electoral vote is what
Yeah,
matters.
the electoral college.
Mhm.
Right, that's what matters. Okay. This item talks about air filters. That's a subject that we've talked about on occasion, but this is particularly important for people living in California or areas where they have the wildfire smoke exposures in the West. And of course, we had some experience with that here in district because of the Canadian exposure. And the smoke came over to New York and to the district. And so the question of getting filters in your house became an issue, especially in people who have asthma. You know, it's interesting because I had one of my sisters died of asthma, and actually one of my sister's birthday was last week. And so I was thinking about the fact that in those days, filters, we didn't have filters in the house, might help for asthmatics and people who have pulmonary conditions. And if you have filters in your house, we generally don't have them, but I think we do in my house because
I had one as well.
yeah,
I think we have one on our furnace.
Yeah.
okay, well, people with respiratory problems having a filter in the house is helpful.
Fair point.
Okay, let's go to the next one. Now it's really getting serious. The FDA announces new voluntary sodium reduction targets, shooting for less than 3 grams a day, which is shocking. As you all know, our population is salt sensitive, and the amount of salt intake increases the likelihood of hypertension. And so this is a move in the right direction to decrease the amount of salt that one should take in daily. So we're moving closer and closer to healthier and less salt. Of course, one of the things that makes a lot of things more tasty is salt. And so that's why we go to a restaurant here and they use a lot of salt. So any comment on this? This is a move for the betterment of us.
I have a comment. I've noticed that more, even though I don't eat out as often, maybe once a month. A lot of the restaurants that I eat at have little to no extra salt on the food, and it's, yeah, sometimes you have to ask to, for the salt shaker that if you want to, but I've kind of gotten used to it, not having all that salt, and the food still tastes good. I just thought if anybody else had noticed that.
Yeah, I noticed that because my wife likes salt, and they rarely have salt shakers anymore, as you have observed. Let's go to the next article. Of course, those of you guys who like French fries, that salt on is what makes it so tasty. This is an interesting article. It talks about aggressive test strategy to detect ovarian cancer, which, as we know, is often diagnosed very late in the case. And when you diagnose it late, it's very difficult to treat. And as a consequence, they have a new protocol where they're emphasizing cancer antigen test and transvaginal ultrasound scan if there's any suspicion of gynecological problems. And they are finding that when they use these techniques, that they're more capable of making a diagnosis of ovarian cancer. This is something that is relatively new and something that is very important because most of the ovarian cancer is found late. And to find it earlier, you can treat it better. And there are a number of treatments that are now used that may be effective, chemotherapy and other surgical treatments that are more effective. So that it's not just the CA-125 alone, but it's the ultrasound as well, and also being sensitive to the symptoms that had been ignored in the past. And as you go down, you'll see the symptoms that were very common that people missed. Bloating, for example, having symptoms of early satiety, indigestion, and pain. Those are symptoms that are general, but when you understand that this may be an early sign of ovarian cancer and act accordingly, it is evident that this is a change that may result in the earlier diagnosis of ovarian cancer when it can be treated.
So my question was almost, I think, answered. Why would you look for this? And then, once you see those symptoms, is it expensive to look for this, or, I mean, should it be like a standard?
Well, what they're talking here is a protocol that they're using for patients who have any symptoms that would generally be overlooked because they're so general. Like bloating is a general symptom. Pain is a general symptom. Indigestion is a general symptom. So that if you have any of these symptoms, then they would want to use the vaginal ultrasound and the CA-125 test to make an earlier diagnosis of ovarian cancer. In the past, doctors have been ignoring these signs and symptoms, and therefore they make the diagnosis when it's too late.
Satiety.
Oh, I'm sorry. Early satiety means that, for example, when you used to eat a whole plate full of food. Now you eat 1/4 of that and you're full. You used to not be full, but now you get full earlier with less food. And that's an early symptom that people would overlook in the past. But now if you see that you have that, that's one of the early signs of ovarian, can be an early sign of ovarian cancer. It can be an earlier sign of other things as well. But the fact that you're sensitive to it and recognize that this may be a early sign of ovarian cancer can lead to you getting the CA-125, getting a vaginal ultrasound, and doing other tests to try to identify why you have bloating of your abdomen, which is so general that you might, and I recall Janice talking about her sister who had bloating and they thought of everything else but ovarian cancer.
Yeah. Had this protocol been in place, definitely would have saved her. But her doctor kept telling her to lose weight, to exercise. Well, she couldn't. She just didn't have the energy. And very bloated. She had to wear maternity tops. And then one day the doctor, oh, I think you have cancer. So the tracking of the CA-125 didn't come in place until much later, close to a year. So it didn't help her much. But I just felt like the doctor could have done more. And one of the things that the cancer doctor told her, she had to have surgery several months after it was diagnosed. And she had a patient advocate who was working with her and told her she shouldn't go into surgery with the negative feelings she had for the doctor, the original primary care doctor. Go talk to her. And she agreed to do it. I said, you want me to go with you? No, I'll do it. But after that talk, she overlooked the mishap or the overlooking of what her primary care doctor did not diagnose. And she did continue to go back to her later. But to me, that was a gross diagnosis. And it went on for about a year. The tiredness and the bloating, and she had the ascites or whatever you call it, the belly fat. But she did have the surgery and she went into it with a clear mind. But it was a difficult time because I felt it could have been avoided, or with that diagnosis sooner, of course, it would have prolonged her life.
Thank you for sharing.
Mm-hmm.
Okay. This is an interesting article. It talks about going to the doctor and getting treated for asthma. Since asthma is in my family, I'm very sensitive to the fact that people have shortness of breath and have to go to the doctor frequently, and also have to be treated aggressively for any kinds of infections that they have, and they have to have nebulizer treatments and other treatments to open up the bronchial trees. And if they fail to visit the doctor periodically, and they fail to take advantage of any infection that they have, that they can easily have asthmatic episodes and actually die from them. And so it's important that they actually see the doctor frequently. And asthma is a chronic condition that when treated by frequent visits and medication, death from asthma can often be prevented.
Dr. Cal, I saw in the Olympics, one of the swimmers had an asthma attack. You know, you don't really associate asthmatics as being, you know, great athletes, but I think she was one one of the winners of one of the meets there, and came right off, and I mean, almost had to be hospitalized.
Yeah, you'd be surprised how many of them actually have asthmatic histories.
Yeah. This relates to me as well. I have asthma. So just before logging on, I had to call my doctor. One of the things I do is carry albuterol. Albuterol isn't supposed to be used as a daily treatment, only when needed. And my asthma condition isn't considered severe, but from time to time, you do have an asthma attack. So that medication should be readily available. Because I seldom use it, I didn't realize I was out of it. I had my last inhaler, but it expires September 2024. So this morning I called to get it refilled, but you also have your daily medication. For me, it's Symbicort. A couple of weeks ago, I had to go to the doctor. That 100-degree weather, I mean, it did something to me. When it's 100 degrees, he said, stay in. So when I have to have the spirometry test, which is the breathing, I didn't do very well. And it's something, I said it just happened. I was diagnosed when I was 50. And I told my doctor, who gets asthma at 50? He said, you didn't. You had it as a child, but it probably laid dormant. And I can see that. It was 50 of us siblings, and mom and daddy, not 50, 8 siblings. And mama was the doctor. You know, she'd go in there and whip up something and you feel good and you back out in the street. But by the time I turned 50, I began to have respiratory problems. And I had an older brother who was about 8 years older than me. We both were diagnosed with asthma at the same time. He wouldn't take his medicine. He didn't do anything right. And of course, it didn't work for him. The day my husband was called for his last transplant, that was the day my older brother passed. And the strange thing was, the night before I talked to him, you got to take your medicine, you got to eat properly. His words, this damn asthma is going to take me away from here. The next day, it's gone. So if you have an ailment, take care of it. Take your medication.
Yeah, you know, and asthma is a disease that can occur in later age, and in some people who've never had an asthmatic episode before get it later on and have actually died from an episode. So that, as you said, it's a serious disease. My sister died from asthmatic episode, but she had asthmatic episodes all her life. And she finally had one that was fatal.
Well, I'm also in that number. Our sister died also from an asthmatic attack. And actually, I hadn't been around my sister that much as an adult, but this was back in the 80s. She died in 1982. She was only 42, but I didn't even realize she really had asthma. But she lived in Florida, which I understand was not the best climate for her to be in. Found that out a little later on, but she was just walking down the street and had an asthma attack and passed. Just suddenly.
Yeah, that is something that can happen. People at that age, and was that her first episode?
Yeah. I really don't know. I don't know whether my other sister really, but she lived in Florida away from us, so I don't really know whether or not she had one before, but it was kind of a shock to us at the time.
Yeah, our population has a lot of asthma, and if you can't breathe, you can't live. So,
Right.
yeah. Okay, well, it's a good opportunity to revisit the importance of treating things like this. Now back to processed foods. What is processed foods not linked to? And here we have it's linked to diabetic complications. And this is just the latest in the number of issues that processed foods are linked to. So that dietary discretion becomes critical, not only for diabetics, but to everybody. And this article just points out that many of the things that are processed contributing to our health, ill health, whether it's the retinopathy, the neuropathy, kidney disease, etc. It's all worsened by processed foods. And of course, diabetes is one of the diseases that affects you from the head to the toe. And so keeping diabetes under control is something that is imperative for diabetics. And that's why we talk about them knowing what the hemoglobin A1C is and why they need to monitor their blood sugars and their hemoglobin A1Cs, keep them as normal as possible to avoid many of these complications. And then, of course, the processed foods doesn't help any of them. Any comments on the subject which we have discussed almost every week? Okay, next article. Well, I think there's much ado about nothing, frankly. But anyway, post-traumatic stress disease is a disease that is probably the cause of suicide for many of our veterans. And it's a disease that is contributed to by the lack of mental health care. And whether you have a new name or not is not really the problem. The problem is that we don't treat mental health with the aggressiveness that we need to have. And that's because we have psychiatrists who and psychologists who won't take care of patients who can't pay cash, and some patients who would like to be treated can't be treated. And so it's one of the issues that I wish our presidents would make a priority, because we have so many mental health issues, and yet we have such a poor system for taking care of mental health. And that really is what the real issue is, not what you call it, but how you treat it and how you prepare mental health treatments for everyone, which is not the case. So whether you call it brain injury or brain PTSD or PTSI is not really the problem. And the problem is, so name change isn't going to make any difference. What's going to make a difference is the mental health care that the people who have this problem have. And that's what I think should be the subject of concern, rather than we call it PTSD or PTSI. But anyway, this article is about changing the name from disorder to injury. And they're talking about dignity. The dignity is when you go to get mental health and you can't have it. That's the lack of dignity. And that's the situation we have in this country. And it's something that we need to make a priority, whether you call it PTSD or PTSI. Any comments about this? Because that's just my opinion of it, as I've watched the suicide rate in veterans go up and up and up, and recognize that the mental health treatment that we have for soldiers and others for mental health illness is far below what I would call standard of care.
I'd like,
I'd like to say touche for everything that you just said, Dr. Calendar. And I know you put the spotlight on veterans, but if we don't put the spotlight on our children with everything that we know the impact of the pandemic has had, I mean, all the red flags have gone up with the impact of isolation, lack of intimacy. There's so many signs. And if we do not connect the dots, that these signs of mental unwellness is going to have on this future generation, we're in serious trouble.
Well stated.
Yeah. And you know, it's not just being inside from COVID, being isolated from COVID or the military. We've got a lot of children in the inner city that are subject to gun violence. You know, in their neighborhoods, they hear gunfire all day long. They go to funerals of their friends, family who've been shot by gun violence. There's a lot of PSD associated with that. You know, and there's loneliness too, because in the inner cities, kids can no longer go out and play, too scared to go out and play.
Great points. Great points. Any other comment before we go on? Okay, next article. Sugar substitutes are meant well, and particularly for those who can't take sugar at all, but they affect the GI tract, and as such, they are causing as many problems as they are supposed to correct. And they have identified in this article many of the so-called sugar substitutes. And they've also identified the consequences of using these substances. And if you're a diabetic and you can't take sugar, then these are the substitutes that are available. And so as a consequence, this has caused other problems, especially in the GI tract. And this is what this article is all about. We're talking about the microbiome. We're talking about the good and bad bacteria that are in the intestines. And the good bacteria need to survive and the bad bacteria need to go away. And so sometimes these sugar substitutes reverse the situation so that the good bacteria decrease and the bad bacteria increase. And this then is our concern. Okay, any comment about this article that
Yeah, there's another sugar substitute that's not chemical, and that's when baking. And I'm reminded that because 3 weeks ago I had my first anniversary, and so we thawed out the wedding cake that my wife baked, and she baked it without any sugar. It was sweetened with bananas, apples, and dates. So for cooking, those are great sugar substitutes where it can taste great without adding sugar.
Thank you for that.
I also noticed too, Dr. Calendar, that you don't see the substitutes around like you used to. You know, not that I go to the restaurants that often, but you don't see them there. And I know we definitely don't use them at home. The little bit of sugar things that we need, my husband uses honey most of the time, and I use just a sprinkling of sugar, just regular sugar, rather than the substitute.
Any other comment? Okay, I guess we have time for one more article, and this is a very good article that points out the fact about what they call nutrition security and nutrition insecurity. And what this relates to is the plethora of McDonald's sites and the lack of grocery shops that allow for people of low means to get nutrition. And this then is an issue for all, but it's a particular issue for diabetics because if you don't have the right nutrition, then your diabetes will be uncontrolled. If your diabetes is uncontrolled, you get complications. Complications such as going blind, requiring amputations, and having heart attacks and kidney disease and so forth and so forth. So that food insecurity is a huge problem for people who don't have funds. When you're poor, it's hard to get good food unless, as Darryl said, you're going to be willing to become a vegetarian or a vegan. I think food insecurity is underappreciated as a cause of ill health. And one of the things that becomes critical is to think about the presentation that Dr. Bowman made that talks about food as medicine in terms of understanding that the food we eat is partially responsible for most of the ill health that we have. Any comments about that?
I think as we're moving now to address many of the issues that Vice President, soon to be President Harris is making, that these ideas and the fact that both the Vice President and the President come from quote unquote middle class, that the ideas of having a plethora of good food and nutrition resources in our community should be the outcry from the people who will elect these two into office. So what we're doing in terms of making sure that they are elected, we must continue to make sure that our communities reflect what's important to us now.
Well, of course, if Trump gets in, then
that's not going to happen.
Right. So
that's and making sure that everyone appreciates that. But once November 5th is over, the work is not done.
No, and that may, politicians promise a lot but deliver a little. And you got to keep that in mind as well.
We have to keep them accountable.
Yeah, right.
As you have kept me. As you have kept me, you have raised the standard. I do not know a surgeon that has been trained at Howard that has intersected, well, all have intersected with you, that have a level of professionalism that is unmatched. And when we raise the standard, they follow, and your surgeons have followed. And you as an example to that, I think that I know we can do it. I know we can change our communities. I know we can change the state of our health.
Well, this article suggests that you're right, and that this is a prime concern as we go into this election. And it'll be interesting to see how these matter during the elections. And you can see that 5 of the top 6 concerns related to the cost of healthcare and health insurance. And as we know, Trump spent most of his time trying to eliminate everything that Obama did. And everything Obama did was to have more healthcare available to the community. And so it's going to be critical that we have people in place who will try to emphasize the importance of improving our healthcare. The fact that the United States is one of the sickest countries in the world is a disgrace, and says that we don't take our healthcare serious. Now we spend enough money. Not that we don't spend enough money, because we spend a lot of money, but we are not in the top 10 in the healthiest countries in the world. And that's something that should be a top priority for us.
Dr. Calendar, I've noticed that a lot of my friends who are, above 60, 70, who have been put into the role of caregivers for their elderly parents were not prepared for that. And I'm hoping that this administration will help to build that knowledge and that infrastructure to take care of the elderly. Even though they're places like Leisure World, which are facilities, but once you get put in that role of a caregiver, your life changes. That's for sure. And I think more needs to be done in that area.
Well spoken. Well, I guess that I think that should take care of it's 10:30 now, so I think we should close with that thought.
Okay, one thing, birthday.
Yeah, yes. My husband is behind me saying, before we go, I would just like for this group to acknowledge my sister's birthday tomorrow. And I hope she doesn't mind me telling her age. She will be 86 on tomorrow. And so I just want everybody.
Congratulations.
Happy
Congratulations.